everyone. I'm Tatiana Bido, Director of Aesthetic Content for NewBeauty, and we are here at ASDS Chicago, where we're learning about the biggest innovations of 2025. And I have with me here Dr. Tina Alster, Dr. Daniel Schlessinger, and Dr. Mary Lupo, three esteemed dermatologists and our best resources for so many topics that we cover at NewBeauty. So today, let's talk about what we're hearing about a lot of in 2025. What is one innovation or treatment that you think is truly changing the industry right now?
Well, the one thing that I think is changing the industry is just some of the combination treatments that we can do. I've long been doing fractionated laser technology with microneedling, and I still do that every day. But now there's a new device from a company called Aclaro that actually will bore down a little deeper into the skin and cause a little bit more collagen remodeling. So it's really good for wrinkles around the mouth and large pores and gives a really fast and easy recovery. So I really like that particular device. I'm not being paid by them to say anything.
Is that laser?
Yeah, it has laser coring, and I do think that that's something to keep an eye on. I'm still a little bit concerned about the recovery from laser coring, no matter what the device. But I do think that is something that we'll be hearing more about as the safety improves.
Thanks, Tatiana. One thing that we're hearing a lot of is about AI in our field and what is AI doing and how are we using it. And I'm still not exactly sure how people will be using it, but I'm seeing it integrated into the devices themselves more. So some of the lasers are actually using AI to produce safer outcomes. So one recent one, for example, has been the BBL Heroic laser, and it uses AI to see where the laser is in space and time and adjust the treatment endpoints so that you get evenly spaced out pulses of light as you go along. And it's made it a lot more predictable and a lot easier to use.
Well, I do hate to be redundant, and I have no financial interest in the company, but my big breakthrough has to be the Aclaro Ultra Clear device. And I've had it since 2022, and I added the laser coring in 2024. So I have quite a bit of experience. I understand you've gotten it just relatively recently. Nina, your associate, told me this. And there really is a reason and why I think it's so innovative. Number one, for me, I live in a place that has a very diverse ethnic population, and the ability to tailor a device, one device for all skin types, is just really, from a business standpoint and from a patient care perspective, a game changer for me. So that is one thing. And then the other thing is the variety of levels that can be used. Everything from something that's basically no downtime at all, like a light laser peel called the 3D Miracle, all the way up to deeper resurfacing with the Ultra. And I have been using the laser coring. And I can tell you, Tina, I have a little secret that we'll talk about in the next segment or two of what really has enhanced healing and given really good outcomes with no complications.
Okay, outside of the Aclaro device, is there any new technology or innovation this year that you're using at your own practice that has impressed you the most?
Well, it may not be a device that I'm treating patients with, but I just have come across a technology talking about AI, where you can make an avatar of yourself, the provider, and give preoperative information about any number of conditions so that you're not repeating yourself a gazillion times and still not getting the story across to patients, so that patients can actually go on and see either a live image or an AI generated image of you talking about that procedure, not just preparing a patient for a particular procedure, but also talking them through the postoperative recovery and what to expect. So I cannot wait to start this for me and my patients, my practice. It will save an immense amount of time. And that's where I think AI, at least in the near future, can make a big difference with delivering patient care. You talked about having AI with a device such as an intense pulse light. You know, the intense pulse light is across a number of different, practices, spas, et cetera. But my problem with it is that it's not necessarily the device that's doing the work, it's the person who's doing it. And even with AI telling you how deep something can go, you still have to realize if the patient's a good a good candidate for that treatment. So with AI, I'm still a little bit suspicious about it delivering what we want in every patient. But right now, I'm very excited about the potential for educating patients.
Wonderful.
Thank you. On the continuing the AI trend, I have another use of, we've been using AI more in kind of back office things to help with the check-in process, communicating with patients off hours to give them information about our cosmetic treatments that we offer and start the consultation process, even if it's a weekend or if it's 2 a.m. Sometimes those patients aren't the most reliable patients, but it still helps things. And so we're using it for that. We're using it for prior authorization support. A tool called Tandem has helped us on the more medical side. I have looked into some of the avatar-based things, and I'm excited about it, but I think there's a little bit of work is needed with making sure, and I'm sure you looked into it, but make sure that you don't give away too much, because if I was on a panel last year with someone who was using that, and they found out later that they had actually signed away their name, image, and likeness to the company when they did the avatar thing. And so you have to be really careful, read all the fine print before you do the avatar thing, or else they might get more of you than you bargained for.
A very good point.
Well, if you want me to add one more innovative thing, it's actually an innovative use for something we've had for a while now. And I think that's valid. Sometimes we get so wrapped up in what's new,
Yeah.
we forget that it's very important to intuitively and creative advance the uses of things that we already have. So what I have done recently in the past 2 years that has really been a big deal is I am now using deoxycholic acid, known as Kybella,
Yes.
in a very, very, very off-label use, which is legal for physicians to do.
Interesting.
And I am using it in the area that the company specifically told me initially, don't use it here.
What area would that
Just-
be?
And
Okay.
it works
So right here.
so well in that fat pocket. And when used in conjunction with the laser coring, I posted a 79-year-old woman and everyone thought she had a facelift. So I think as physicians, and this is what makes us better than AI, is our ability to intuitively and organically take information, take our experiences, and translate that into a new outcome, a new use.
Yeah.
And I think that's invaluable, and AI will never be able to do that.
You brought up a good point about work that's so good that it looks undetectable. And that was a huge, huge buzzword this year. Undetectable treatments, undetectable surgery. Are there any buzzwords or phrases that you heard in 2025 that you think people need more education on?
Well, I think there are a number of things out there that people say they want, whether it's glass skin or not having any movement, which really looks unnatural. Of course, in Washington, people want to look natural. There's another sector of Washington that wants to look terribly unnatural. And so I really like the natural component of this. I'm all for what Mary had just mentioned in terms of maybe using our noggin as practitioners and being in this business a long time, using things at our disposal that aren't necessarily new for maybe a new purpose. And another case in point is using Botox or Dysport or any of the neurotoxins to go after enlarged salivary glands, like the submandibular glands, which often pull down on the neck. And even after facelift, you have these enlarged glands. And if you shrink those down using a toxin, which has been proven to be very successful, you can also give a better contour to the neckline. So I'm really excited about some of the new things, but I'm just as excited about things we've had for a long time. Case in point, as Mary said, sometimes the old can be used for a new purpose.
Yeah, I think that's a great point. I think people are talking a lot about regenerative aesthetics and longevity and skin health and skin longevity. I think part of this probably stems from another buzzword, which is filler fatigue, and it seems like there's a lot of people who, as of the last year or two, are wanting to inject anything into their face other than hyaluronic acid. And I don't think it's a great thing either. We've been using hyaluronic acid for decades, and it's a known thing. It's very predictable. We know exactly what it does and doesn't do. Some of the newer things that are out there Just because it's not hyaluronic acid doesn't necessarily mean that it's natural, doesn't necessarily mean that it's good. And in the end, it comes down to not always just the product, but who is injecting it, their skill level, their training, and how they're injecting it to get a really natural and undetectable look.
I have a big pet peeve in the world today, and that is calling things by other than what they really are, like daylight saving time. We're not saving anything. We're daylight shifting time. And we need to start calling filler migration what it really is, which is over and improperly injected
It's
filler.
technique.
And when you put too much in a space, it's going to move to another space.
Mhm.
So I think that what you're seeing now is people realizing that maybe you should stop looking at your bridge group in a little circle, and all of you all have been over-injected by the same person, and thereby that over-injection has somehow been normalized. So one of the good things about social media is people are now calling out bad filler.
Yeah.
But it's the bad filler is not the product. It's the capital F person filler who's doing it incorrectly.
Yeah. Very interesting. And what do you think about like the salmon sperm trend? All of a sudden, everybody's really into salmon sperm, or like you said, other injectables that aren't filler and using it around. What are your thoughts on this new movement to, like Dr. Daniel Schlessinger said, use anything else other than filler and call it natural?
Well, I always tell my patients that poison ivy is natural and you don't put that all over your face. So, I certainly wouldn't have anybody inject anything in my face that isn't well studied for use in my skin. And that is with controlled studies that have been basically published and recounted many times. So the salmon sperm facial, unless you want to put that junk on your face, I certainly wouldn't have that injected anywhere on my body, much less my face.
Yeah, I mean, a lot of these treatments that you mentioned, like salmon sperm, it's not just that it's off-label for injection. It's not that they're not intended for injection at all, and maybe they are in a different country, but at least in the U.S. right now, they're not. And so we've seen this proliferation of companies making products that are not at all intended for injection, but people are injecting them, and in some cases, getting some really disastrous complications. So personally, I steer clear of any of that stuff until we have the clinical trials in humans in injections to really bear it out. And I counsel my patients about that too. I always tell people it's like, driving a sports car. In the right hands, you can get really great results, and in untrained hands, it can be disastrous.
Well, I'd like to specifically point out that it can be very dangerous for a company to have their product used improperly.
Right.
Of course, this excludes my improper use of Kybella. but you run the risk of the product getting a bad name. So I want to specifically address what is called platelet-derived growth factors.
Yes.
And I use those at least 3 times a week.
Do you use them topically?
Yes.
Yes.
Post laser.
Right.
And I think one of the reasons that I have this seamless recovery from aggressive laser assisted coring is those patients get the platelet derived growth factor. So here is a great product that I learned about from my plastic surgery colleagues because they put it in a facelift incision line
Yeah.
to improve healing. So here's a good product that's running the risk of getting a bad name
Right.
because it needs to be studied for a new indication.
Yes.
So, I think that's what we're dealing with. But platelet-derived growth factors, when used for aggressive laser resurfacing, improve the outcome dramatically, in my experience.
Yeah. I think the note or the takeaway here is you really have to go to the right person who knows what they're doing with what's available right now, because there are a lot of people in the industry who are injecting some of these things and saying this is going to, clear up your under eye bags. But like to your point, Dr. Schlessinger, we don't know over time what that's going to do for the patient and if it's going to be harmful. So I think education is key. So that's what we're here to do. So thank you for talking to us about all of this. And in terms of trends for 2026, my final question is, what area do you think is really going to explode next year?
Well, the area that I think is really going to explode is this regenerative type of anti-aging, and incorporating not just what we do with the skin, but what people are doing in their bodies, supplements, etc. The jury's still out as to the best combination. There's probably many different types of combinations that will be available. I also think to keep an eye out for AI on and within reason in terms of getting the education one needs, and to really trust the hopefully physician that people would be consulting with to provide the best treatment moving forward. There's just so many one horse pony type of situations where there are people who only do one thing. They don't have all the other things that we may have available in our own offices. And you really would like to have somebody who's not only experienced with that one thing, but has experience with a number of different things so you can get the best recipe for what it is you're after.
Thank you. I think there's going to be, like you said, a focus on regenerative, and it may be a more holistic approach to the patient's overall health. I mean, we're looking not just at volumization, but we're also looking at the quality of the skin and defining what it means to have good skin quality. And maybe that's something that we can't even really judge with our naked eye. Maybe we need to use an AI to look at that and look at microscopic tiny pores on the skin and count them up in a way that a human just simply can't do. So maybe that's where we find a helpful balance between human input and AI input.
So I actually have two comments on that topic. So one is, I think one of the things we're going to be hearing a lot more about in 2026 is regenerative medicine from the standpoint of reversing age senescence of skin cells, because they're working on rapamycin receptors that have the ability to sort of change actually how cells respond to other things. So I think that's one thing we're going to be hearing a lot more about. But the other thing that I'd really like to see, which I think could exponentially take everything we currently have and will have in the next year and really take it to the next level, is some way to do genetic testing to understand better what are each individual patient's needs. Mm-hmm. For example, there is the ability right now that you know people who have the inability to handle glycation end products as efficiently as other people.
Yeah.
And that we know this genetically. We know who can rapidly metabolize caffeine and who cannot. And I think there's the capability, even on a very, very high level, that if we can find out when people are young, do they have the genetic predisposition for osteoporosis? Those people need to be on HRT quickly. Mm-hmm. Do you have a tendency to have degradation of collagen at a faster rate? Those are the people who should never go out in the sun and really need to address it early on. Who are the people who are prone to addiction because of how they metabolize drugs?
Yeah.
We know that ahead of time. How many lives can we save by protecting them from ever getting an opioid for anything? So I think the truth is out there, yeah, to speak, and we just need to refine how we gather the information in an ethical way to enable and empower patients and their doctors to give them fabulous care in the future.
So we're all going to have genetic testing, and we're going to be wearing our wearables and have our apps that tell our doctor exactly what's going on, our history, and how you can help us, right? Yes. Well, thank you so much for joining NewBeauty today. And here at ASDS, where all of the latest aesthetic innovations are being unveiled right in front of us. Thank you so much for coming and speaking on the latest and the greatest.
Thank you.
Thank you. Thank you.